Today we're diving into the world of carbohydrates, the good, the bad, and everything in between. Carbs are one of the most misunderstood nutrients out there, so let's break it down with a bit of science to help you make informed choices about your health. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. Please like, subscribe, and share to help this channel grow. So what are carbohydrates? Carbohydrates are one of three macronutrients that your body needs, the other two being fats and proteins. When we eat carbs, they're broken down into glucose, a type of sugar that our cells use for energy, as you all know. There are two important factors that are different if you compare one carb to the other. So one of these factors is the speed at which this breakdown into glucose happens, and the other one is how much glucose enters the bloodstream at once. So what makes a carb good or bad? So let's translate that into more scientific terms. It comes down to two key factors: glycemic index and nutrient density. The glycemic index measures how quickly a carbohydrate is converted into glucose and how it affects the blood sugar levels. Good carbs typically have a low glycemic index, meaning they break down slowly, releasing glucose gradually into the bloodstream. This keeps your blood sugar stable, avoiding highs and lows that can lead to fatigue or sugar cravings. In contrast, bad carbs have a high glycemic index, causing rapid spikes in blood sugar followed by crashes. So now let's talk nutrient density. Good carbs, or complex carbohydrates, are rich in fiber, vitamins, and minerals. And that includes whole grains like oats, quinoa, brown rice, and fruits and vegetables, of course. The fiber in these foods slows digestion, which stabilizes blood sugar and supports gut health. In contrast, simple carbohydrates, often found in processed foods like white bread, sugary cereals, pastries, and candies, and they're stripped of fiber and essential nutrients during that processing process. These empty calories provide quick energy but lack nutritional benefits your body needs. So let's look at why complex carbs are considered good. So they promote slow digestion. The fiber in whole grains, legumes, fruits, and vegetables slows down digestion, leading to a more gradual release of glucose into the bloodstream. This not only helps maintain steady energy levels, but also keeps you feeling full longer, making it easier to manage your weight. The next factor is blood sugar regulation. That's kind of intuitive, of course, but foods with a low glycemic index prevent rapid spikes in blood sugar, which is especially important for preventing insulin resistance, precursor to a metabolic syndrome, then type 2 diabetes, of course. The next and very important benefit of complex carbohydrates is how they affect your gut health, which we talk a lot on this channel. Complex carbs provide fiber, which acts as a prebiotic, feeding the beneficial bacteria in your gut. A healthy gut microbiome is linked to improved digestion, reduced inflammation, and even better mental health. Now let's look at the downside of bad carbs, or why simple carbs are called bad. Well, they cause rapid digestion and blood sugar spikes. Simple carbs found in processed foods like white bread, sweets, and soda are digested quickly, leading to sharp increases in blood sugar. When your body produces too much insulin to lower blood sugar after these spikes, it can cause a crash, leaving you tired, hungry, and craving more sugary foods. The next downside is well known to many of us. It's weight gain and other health risks. Regular consumption of high glycemic, low nutrient carbs contributes to weight gain because this excess glucose that isn't immediately used by the body has to be stored as fat. Over time, this can lead to insulin resistance, increased fat storage, and higher risk of conditions such as type 2 diabetes, cardiovascular disease, and even certain cancers. The other downside is nutrient deficiency. Bad carbs often lack essential nutrients, meaning that despite the calories you consume, you are not giving your body the vitamins and minerals it needs. So it's essentially a malnutrition. This can lead to fatigue, weakened immunity, and long-term health complications. So how to balance carbs for optimal health? the goal isn't to avoid carbs altogether. It is to make better choices. A balanced approach to carbs involves choosing nutrient-dense, slow digesting options that provide lasting energy and support your overall health. Some tips for finding the right balance include: focus on whole foods. That means that please choose carbs from whole, minimally processed sources like fruits, vegetables, legumes, and whole grains. Pair carbs with proteins and fats. That's very important. Combining carbs with healthy fats and proteins helps even slow down the digestion even more, preventing blood sugar spikes and keeping you fuller for longer. And of course, watch your portion sizes. Even healthy carbs should be eaten in moderation. Focused on balanced meals that contain a mix of carbs and proteins and fats to ensure that you're getting all the nutrients that your body needs. So in summary, the next time you hear that carbs are bad, remember, it's not about cutting them out. It's about choosing the types that nourish your body and keep your body's sugar stable. Complex, fiber-rich carbs are your body's friends, providing long-lasting energy and the whole wealth of nutrients, while simple processed carbs are best enjoyed in moderation. So if you found this video helpful, please like, subscribe, and share for more science-backed health tips. And thank you so much for watching. Until next time, bye-bye.